from the EULAR 2025 Congress in Barcelona, Spain. My name is Victoria Sadovic. I am Professor Assistant at the University of Medicine and Pharmacy Nicolae Testimițanu from Moldova. And I have with me Professor Hylton Menz from the La Trobe University in Melbourne, Australia. Thank you, Professor, for being today with us. And we are going to discuss about your session entitled Foot and Ankle Osteoarthritis. Professor Menz, we know that foot and ankle osteoarthritis receives often less attention compared to other forms of osteoarthritis. In your opinion, what are the main challenges in diagnosing and managing patients with this condition?
Yeah, well, the main problem that we have is that we really don't have a lot of evidence to guide clinical practice. So, for example, in knee osteoarthritis, we have around about 139 trials on exercise alone, but we only have 6 trials on foot osteoarthritis within the first metatarsophalangeal joint and none in the midfoot. So straight away we're at a real disadvantage working out the efficacy of our interventions.
Yeah, that's true, and we know that your research has greatly contributed to our understanding of foot biomechanics in older people. Could you talk about this a bit more?
Yeah. So with aging, we tend to see a number of different factors that are associated with osteoarthritis. The first one is a reduction in the volume of synovial fluid, and the second thing is a reduction in the thickness of articular cartilage, both of which increase the chances of osteoarthritis. Now, specific to the foot, we also find that as you get older, you're far more likely to have a flatter foot deformity, which is an independent risk factor for midfoot osteoarthritis.
And having this information, what do you think are the best methods to treat the patients, including pharmacological but also non-pharmacological treatment?
Yeah, well, we definitely need to look into mechanical interventions in a lot more detail. So, for example, we know that shoe stiffening inserts are quite useful, but we do need larger clinical trials to actually assess the efficacy of that intervention. We also know that things like exercise are very useful, but we've yet to actually conduct clinical trials in this area.
Well, hopefully in the future we will have large clinical trials to prove that these interventions are really have efficacy. And looking at the future, what other methods do you think would have a promising effect in managing these patients and increasing their quality of life?
Yeah, I think the problem is more actually when we deliver the intervention. So if we can catch people a lot earlier in the process, I think the interventions will be more effective. So for example, at the moment we tend to recruit people on the basis of x-rays, radiological changes. So by that stage, we have a lot of structural damage that's occurring. So if we can actually deliver the interventions earlier, I think they'll be more effective. So it's not so much the interventions, it's when we actually deliver them.
Thank you, Professor, for being today with us and for sharing your opinion on this very difficult topic, I would say. Thank you very much to everyone watching us.